The Wellness Revolution starts now.
Hello, I'm Dr. Steve Hotze. Welcome to Dr. Hotze's Wellness Revolution. Today I'm going to speak to you men. I'm going to talk about three things. We're going to talk about testosterone. We're going to talk about low thyroid called hypothyroidism, and we're going to talk about heart disease. And I'm going to explain to you how testosterone, thyroid hormones, and heart disease are interrelated. Let me ask you a question. Men, do you feel like your energy level has been declining over the years? Are you having difficulty losing weight? What about your initiative, your assertiveness, your sense of well-being, your self-confidence, your moods, your goal orientation, your drive, your directiveness? All these are mental functions, and they are affected by your hormones, particularly testosterone and thyroid hormones. Testosterone, of course, is the quintessential male hormone. It's what drives men. When men are young, they join the army if they're in the military, and they learn how to charge hills in the face of machine gun fire because they think they're invincible. Remember the first time you got your car when you were a young man? You got your license, you got out for the first time. What did you do? You put the pedal to the metal and drove it as fast as you possibly could. You remember that? You thought you were invincible. Why? Because you had high levels of testosterone surging through your body. Well, as men age and as they mature, inevitably your hormone levels will decline. And this has an adverse effect not only on your mental function, but also on your muscle tone and your muscle mass, on your cardiovascular function, on your romantic moods and inclinations, and your abilities. These all are indicative. When these begin to decline, they're indicative that your testosterone level declines. Now, by the time a man reaches 40 years old, his testosterone level has declined by almost a half of what it was when he was young and in the prime of life in your early 20s. By the time you're 50, it's a third of the level. By the time you're 60, it'll be a fourth of the level. And by the time you're 70, you're just in the gutter. And oftentimes in the gutter long before that. Now, what causes testosterone levels to decline? Well, normally declines with age. That's just the function of getting older. It also declines in the face of being around petrochemical products. And petrochemical products are everywhere. They're in the pesticides that are sprayed on the food. They're in lotions and colognes you put on your body. They're in the plastic that you drink. It's in the water. The petrochemicals are everywhere in the world, and petrochemical products, which are derived from petroleum or oil, are hormone disruptors. What they do is they go to the receptors and they bind the receptors so your testosterone levels, so testosterone in your body can't properly affect and cause changes in your cells, because testosterone affects every cell in your body. And when you have petrochemicals in the environment, it also decreases the production of testosterone. Who wants that? Would you believe me if I told you, and you may already know this, that testosterone levels and sperm counts have dramatically declined over the last 50 years. So we see, even in young men, we see low testosterone levels. Now, you might go to your physician and have a blood test drawn, and they check your testosterone and say, well, your testosterone level is just fine. Fine for what? The testosterone levels are measured by age group. So there's a normal level for a 20 to 30-year-old, and it's up here. Then there's a 30 to 40-year-old, and the level goes down. The range goes down. 40 to 50, it goes down. 50 to 60, 60 to 70, and it continues down. So you can have, at your age, you may have testosterone level, if you're in your 50s, of a man from in the range of 50 to 60-year-old. But and we have found that most of the men's, even in that range, is always in the very low level of the normal range for their age group. But compared to where it had been in their 20s and 30s, it's dramatically lower. And that's why men will come to me oftentimes and say, Doc, and I know I'm talking about men that are entrepreneurs and have their own business. I've had them come to me in their 50s and go like, I just think I've got to sell my business. I just can't keep up with things the way they're going. I just don't have the energy. I don't have the drive. I don't have the assertiveness that I used to have when I was a young man. Now, by the time you're in your 50s or 60s, you've had a tremendous amount of life experiences. If you're in business, you know your industry, you know your business, you know how to do business. When you were in your 20s, you were full of testosterone, had all that drive in the world, but you didn't have a lick of sense. You were running into every wall trying to figure out how to make ends meet, how to try to build a business, how to be more successful in your job. And now that you've got all that experience, if you could couple it with the drive you had when you were in your 20s and 30s, which is affected by your testosterone levels, this would be a dramatic game changer for you. So these men, I tell them, well, let me tell you what I'm going to do for you. We're going to check your testosterone levels. We get it back, and we find out that it's within the range limit for whatever age group they are, always down in the low end of the range, much lower than it had been, and way below the normals for a 20 to 30-year-old man. And I say, I'll tell you what we're going to do. We're going to give you testosterone. Now, we can give testosterone in injectable form. We can give it in oral form using capsules. Those are two ways. Some people even use pellets. We don't use pellets here because once you put the pellets in your body, they stay for 3 months. If you don't have the right level or you get too much of a substance, that's not good for you. So we like to adjust the dose. And we know clinically what doses work for individuals who may be low in their 20s and 30s in testosterone or low in their 70s to 80s. We know what level to get them to so they feel better. But primarily, we give the dose and increase the dose. I like to personally use injectable on the first visit. Give a good shot of testosterone, and then if a person takes oral capsules, we'll follow that and see how they do and how their symptoms respond. See if they have more energy, more vitality, more direct drive. They think better. They're interacting better. They have better moods. Remember, as a man goes through his life and his testosterone levels fall, men go through what is called andropause. Now, andropause is analogous to a woman's menopause. Like women, they lose their hormones completely when they go through the change of life around 50 years of age. Well, men also have a significant decline, and their symptoms are very similar to women. They don't sleep well. They gain weight. They get muscle aches and pains. Their muscle mass declines. Cardiovascular function declines. They don't think well anymore. They just feel moody. And that's why older guys, sit around, drink beer in their underwear and watch TV. And the wife wants them to go out and cut the yard. They don't do it because they just don't have the get up and go that they used to have. Well, testosterone can be a game changer for that. Now, testosterone will dramatically increase your muscle strength and your muscle mass. So if you're working out and you can't seem to gain any traction by increased muscle mass, and you can't really lift weights like you used to, or you're not able to jog or run like you used to, well, testosterone can be dramatic in its effect. I personally found out about supplemental testosterone when I was 46 years old. I'm 71 years old now. I'm full of vitality and energy and enthusiasm for life, and that's what I want you to have, and you can have that back if you supplement and bring your testosterone levels back up to the levels you were when you're in your 20s or 30s. Now, people ask, well, isn't it dangerous taking testosterone when you get older? Let me ask you this. How many young men do you know that have heart disease and have heart attacks or have strokes? Few and far between. Now, as testosterone levels go down, that adversely affects your cardiovascular function. How does it do that? Well, testosterone dilates up your arteries. It lowers your blood pressure. it causes the heart to contract better because it enables the cells to produce the energy that they need to function in the heart, because the heart's beating 70 times a minute, thousands of times every day. It has to have a tremendous amount of energy, and as testosterone levels go down, guess what? Heart disease goes up. It has been shown that individuals with low levels of testosterone have a dramatically increased risk of heart disease over those men that do not have who do not have low or marginally low levels of testosterone. So testosterone can be a game changer. I like to say this: testosterone can put a tiger, I'm talking about a tiger, back in your tank, and that's what you want to have. I mentioned to you, I've had individuals coming in saying, well, I'm going to retire. I'm just going to sell my business and move to Colorado and live up there the rest of my life. And I said, I tell you what, we're going to get you on the program, and you don't blame me if within 2 months you feel dramatically better. And if within 2 years, if you're an entrepreneur or a salesperson, or even if you're in a business that you've dramatically increased your income. As a matter of fact, I tell them, you've got to promise me after you're on testosterone and you're really hitting them a lick, and you're starting, and you have that drive, and you're growing in your business, you're growing in your income. You've got to promise me you'll get a wealth advisor to help you manage the increased income you're going to make. Your income is going to be directly proportional to your health. People in good health are more productive for a longer period of time in their lives than men that are in poor health. You know that. You know that from looking at generational changes in your family, remembering how your grandfather was, when you were a little boy, was young. He might have been in his 40s or 50s, and now he's 70 or 80 and just dragging around. He has no energy. You ever go to the golf club or go to the club and see the guys come out of the shower, the old guys, and they're all just slumped down and their muscles are all hanging, got little muscle. Their drives don't go near as far as they went when they were younger, and they're pale and they're pasty and just look gray, and they don't look well. That's because they have low levels of testosterone. Testosterone causes your bone marrow to increase your red blood count. So as men decline in their testosterone, their red blood count goes down. It stays within a wide range of normal, but it goes down. They don't have that ruddy, healthy appearance that they had when they were young. You know how young men look? They look vital. They're got get up and go. The older guys look pale and they look fragile, and they don't do well. I remember one gentleman had a restaurant here in town in Houston, and he came to me at the age of 50 and said he'd been to Mayo's and he'd been all over, and they told him, there's nothing wrong with him. He said, I'm going to have to sell my restaurant, Doc. I said, let me just tell you what, we're going to get you up on our program, which includes testosterone and thyroid, and get you on a good healthy eating plan. We're going to get you on vitamins and minerals and a good exercise program, and we're going to get you feeling like $1 million again, and you're going to make $1 million. He told me he was generating about $345,000 net profit in his business. Well, a year later, he had built 4 new restaurants across the state of Texas, and he says, Doc, I'm making more money than I ever believed I would make. I've had this story told to me over and over again. I remember one gentleman told our concierge in the front office that he wanted to see me. She calls up and says, there's a man here, he wants to see you, and he's in room 3. So I went down to room 3, and I introduced myself to him, and he said, Doc, I just wanted to thank you. And this is what we do at Hotze Health and Wellness Center. We help you, if you're willing to take charge of your health, and you're responsible for your health. Remember, I'm not responsible for your health. You are responsible for your health. If you're willing to take charge of your health and make an investment in your health, it's the best investment you'll ever make. As I mentioned to you before, healthy people are more productive. They do better in life. They have better relationships with their children, with their spouses, with their friends, with their business associate, with fellow church members. They have not only great relationships, they're more productive at work. They're fun to be around. They're enthusiastic about life. They've got ideas. I had one other young man that worked for Exxon came in. I say young man, I'm 71, and he was about 50. And he said, Doc, I need help. I've been with Exxon for 30 years, and now these young guys are coming in, and they're running circles around me at the conference table. I just can't keep up with them like I used to when I was young. I said, look, let's get you up on some testosterone. Let's take a look at your thyroid levels and your symptoms and see if they're related to low thyroid, which they were. And we do treat for thyroid even in the face of normal blood levels, because the range for thyroid and all the hormones is determined by where the average is, plus or minus 2 standard deviations, which is a statistical term that incorporates 95% of the population. So whenever you get a hormone blood test, 95% of the time you will always fall within this wide range of normal for your age group. Well, you don't want to be in when you were young, you were at an optimal level. Now when you're older, you're already down to the bottom level compared to when you were younger. But the docs say, well, your hormone levels are just fine. But I'm not, Doc. I'm not fine. What's going on? Oftentimes, they'll say, well, you're just a little depressed. Why don't we give you an antidepressant, give you a psychotropic drug, and that'll get you all screwed up. So you don't want to do that. You want to replenish your body with the same identical hormones your body used to make, and these are available. They're not chemical counterfeits. They're the identical molecule your body made when you were young, and we want to replenish that. We want to fill the glass back up. You don't want a glass half empty. You want a glass full. You want to be at your optimal levels when you're taking hormones, both testosterone and thyroid. Now, thyroid hormones are made by the thyroid gland in your neck. I've asked men, where's your thyroid gland? I'll ask women the same question. Women go like, well, it's right here. Men go, I don't know. It's somewhere in here. Well, thyroid gland is the gland in your neck shaped like a butterfly that produces thyroid hormones. And the thyroid hormones are what enable your cells, not your blood, your cells and every cell in your body to produce energy. Your thyroid hormones are like spark plugs, and they spark the power plant in your cell called the mitochondria, which produces electrical energy. You are a bundle of electricity. Some of you are low voltage. You've got fatigue, weight gain, difficulty thinking, joint muscle aches and pains. You're constipated. You don't feel well. You get infections easy. And all this causes health problems. When the hormones decline, you get a host of health problems. It's men that are older whose hormone levels have declined who experience significant health problems, primarily cardiovascular disease, which deals with heart attacks, atherosclerosis, which is the hardening of the arteries leading to heart attacks, and you get atherosclerosis in other arteries in your body, and in the brain you have strokes. This is what happens as men get older. They have these problems. But thyroid hormone enters your bloodstream. It's got to be converted from the inactive thyroid hormone, which is T4, a thyroid molecule with 4 iodine atoms attached to it. It's got to get in the cell, be converted to T3, the active thyroid hormone. It acts like a spark plug and sparks the production of electrical energy. So the men I see when they come into the office to see me have already seen their several other doctors. They're on various blood pressure medications. They're on anti-inflammatories. By the way, the anti-inflammatory medication can lead to heart disease. Vioxx was one of the non-steroidal anti-inflammatories that was taken off the market because it caused heart disease. Well, ibuprofen does the same thing. That's Advil. It causes you to develop inflammation in the arteries, and that leads to the calcification of your arteries. To keep them from tearing apart when you have inflammation, the body compensates by hardening the arteries, and when that happens, you throw a clot off and it clogs up, you got a heart attack. And you end up at the doctor's, you have open heart surgery, they put stents in. That doesn't stop the underlying problem. In studies, it's been shown that people that have hypothyroidism or low thyroid levels, as well as low testosterone levels, have an increased incidence of cardiovascular disease and heart attacks. So if you want to keep yourself in good health, it's important for you to replenish your hormones. And those hormones are primarily testosterone and thyroid hormones. That's the way you can help prevent yourself from developing cardiovascular disease. Now, what you ought to do is you ought to have a CT, that's a computerized tomography, a CT heart scan. We have one here at the Hotze Health and Wellness Center. I recommend for every man over the age of 40 to have a heart scan to see if he has any hardening of the arteries, which is called atherosclerosis. We want to check that and see what your status is. It takes about 25 years to cook a good heart attack. So if we have some mild or minimal amount of atherosclerosis, we know you have inflammation, which could ultimately lead over a period of decades to you having a heart attack. And you don't want to have that. When you get older, you want to be full of vitality. You want to be full of energy. You want to be enthusiastic about your life. You want to be able to enjoy your family. That includes your children and your grandchildren, your friends. You want to be able to be out on the golf course or the tennis course or out jogging or riding horses if you happen to do that. You want to enjoy yourself and you want to enjoy your life. While you're alive, you ought to feel alive. There's no reason in the world anyone should feel fatigued and sick and tired of being sick and tired. Let me ask you, sick and tired of being sick and tired? Well, then give us a call here at the Hotze Health and Wellness Center. We can help get you on a path of health and wellness naturally, so you too will have energy, vitality, and enthusiasm for life. Thank you so much for joining me here today. Give us a call at the Hotze Health and Wellness Center. We'll be glad to partner with you to get you on that path of health and wellness. Thanks so much for joining me. I'm Dr. Steve Hotze.
At Physicians Preference Pharmacy, we understand that the quality of your compounded medications directly affects the way you feel, which is why we believe that your pharmacy should specialize in compounding medications while also delivering extraordinary hospitality and guest service. We believe that both patients and prescribers should accept nothing less than consistency and quality from their compounding pharmacy. This is why we've implemented some of the strictest quality standards in compounding, exceeding standard requirements, achieving PCAB accreditation, which is the Pharmacy Compounding Accreditation Board, an organization that sets the highest standards in compounding pharmacy regarding the safety, cleanliness, and quality of your compounded prescriptions. Because of our commitment to complete health and wellness, we are dedicated to making your medications free of lactose, parabens, artificial sweeteners, and any unnecessary dyes, binders, or fillers present in many other medications, offering you the cleanest products possible.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.